Hello and welcome to the All About Medicare series. The health educational series programs are sponsored by the Berks County Area Agency on Aging. I am your host for the series, Ann Barlet with the County Area Agency on Aging. The segment today in the series is on Medicare fraud, and I have an expert with me here today, Mr. John Vogel, who is a trained Medicare fraud specialist and does extensive volunteer work, particularly through Berks Encore, but I think you'll find him at many places throughout Berks County. So I want to start right in on talking about Medicare fraud, and what is it? Let's start right there.
Well, hello, Ann. Thank you very much for inviting me to be part of this. Medicare fraud is a huge problem, to the tune of about $68 billion a year. So it really does affect every one of us who are card-carrying Medicare people. No matter what level you are being affected by the fraud. So many times, and I've been doing this for a number of years now, 5 years as a Medicare fraud specialist, and I can tell you so many people say, well, that didn't happen to me, so it really doesn't affect me. But when we talk about the $68 billion of what truly happens with Medicare fraud, each of those dollars do affect each and every one of us, simply and solely because of the changes in what our Medicare actually cost us. And slowly we find that we are paying more for things. There's more out-of-pocket money. There's more things that we have to pay for, and things that aren't getting paid for any longer, simply and solely because $68 billion in fraud to Medicare actually does occur, and that's on an annual basis.
Oh,
and that's
wow.
not a cumulative.
Okay.
That's on an annual basis that they have been tracking the fraud that occurs within the Medicare system. I do all my work through an organization called CARE, which is the Center for the Advocacy for the Rights and I have to look, the rights and interest of the elderly, okay? So they have a contract with CMS, which is the Center for Medicare and Medicaid Services. Okay. They have a contract. They are out of Philadelphia, and they train us to do exactly fraud, understand fraud, explain fraud to people, Medicare people, and I go around all over Berks County. I actually do about 6 counties now, and explain to people exactly what goes on within the Medicare fraud system. It basically comes down to understanding 3 very simple concepts. You need to learn how to protect yourself. And protecting yourself doesn't mean you have to take a karate class. Yeah. It means, how do I protect something that's really important to me? And it's amazing, and I've been doing this for 20 years in Medicare, it's amazing the number of people that still don't understand that their Medicare claim number is their Social Security number, and how easy it is that we have been understood and explained to protect our Social Security card.
Right, exactly.
Don't even carry it with you, hide it somewhere, exactly. But we carry our Medicare card, and our Medicare claim number is our Social Security number, and we lay it out in front of people all the time, and it does become one of those very simple things that we don't think about protecting ourselves, because that is our number. If there's going to be fraud, it starts with the Medicare claim number, and instantly we've discovered that we've done something with a card, given it to somebody, put it somewhere where somebody can very easily read our number, and we end up the start point of where fraud happens.
Well, and even I've heard so many folks just say, oh, you mean that red, white, and blue card. So we're not even calling it the Medicare card, necessarily knowing what's on it, and the claim number being Social Security. We call it the red, white, and blue card. And as you said, and it's used loosely and freely, and it's not even one of those, like the credit cards with those scams, that you can have a protective situation and protect those from somebody walking by and scamming, because we do open it freely. And I think, again, people don't even understand Medicare and how all of the systems work and what you have as a person. So I can understand how it can easily, I hate to say, it becomes $68 billion.
I think one of the things that people don't understand, and we have had to adjust to everything that is modern and technology and what we do. Amazingly enough, anywhere we go for medical treatment, the first thing they ask us for is our ID, and we instantly take them out. Well, almost every cell phone that you can find has a camera in it.
Right.
And what we have discovered, especially in the last 2 years, is that you are in a line and you've put your card out somewhere, and someone behind you looks like they're talking on a phone when they're actually taking a picture of your Medicare claim number, and you have no idea because you still have your card, you haven't lost your card, it wasn't taken by anyone, but your number was taken. So we start with the concept very easily, understand how to protect yourself. Try to remember at times that if you're going into an emergency room and they're asking for your card and someone's taking your card somewhere to get you into the system, you're not protecting yourself. And it is a hard concept to grasp onto because we have a natural tendency to trust the people who are supposed to be taking care of us.
So that leads me to, besides us, even if we're trying to protect ourselves, then who does commit Medicare fraud? Who is that person or people, group of people that are out there that are trying to steal?
Well, sadly enough, the largest group of people are physicians. And that scares us to no end, simply and solely because we had to find a way to trust our physician. We go in and we kind of feel them out a little bit because I don't want to tell them everything that's wrong with me, so we kind of test them a little bit, never thinking that would be the person who, in truthfully, throughout the entire system of fraud, those are the largest people that commit it. So we do have that group, and there's so many different examples of physicians that have done things over the years, even to the point of, I knew of a story of a doctor in Chicago who was actually doing tracheotomies, and a surgical procedure. And if it wouldn't have been that a daughter said to her dad one time, "What's wrong with your voice?" And she flew in from California to Chicago and found out that this gentleman was doing tracheotomies to people who never needed a tracheotomy, and billing for them for all kinds of things. There's amazing stories that go on with physicians. The story of the person who goes in and they have so much pain in their foot and they can't walk anymore and they're trying to do something, and somebody goes in the back room and comes back out and slides something in their shoe because the doctor ordered this, only to find in the trash can a Dr. Scholl's package. And amazing how the physicians will bill for things, and that's basically how it all comes down.
I was going to say, so it sounds like it's a combination of ways that fraud has occurred. It sounds like or one step process follows the other. In other words, well, we can see if we can do a little bit of a treatment here that really isn't costing us much, but we know it's a billable type of situation. So I have to quickly do something like that insert, but then I also have to bill for that as a separate bill, probably from the office visit or anything else I may have done at that visit. Is that correct? Was
That's
that an
correct.
example?
And you bring up a very good point, billing. Okay, many times, and we have to remember that certainly all of us trust the fact that our doctor is not the one committing fraud. I mean, that's the concept, because we're smart enough
or
to
his
know
staff.
that.
I mean, we also have, a lot of them have teams of staff because there's also groups of doctors, so you've got teams of staff for the doctors.
And that's where part of this all comes into, because it used to be when I was growing up, the doctor's office, the receptionist was either the doctor's daughter or his wife, and the billing person was his wife or his daughter. But today, everything is outsourced to some other place where there's so many different people touching so much of your medical care that you have these openings for fraud that is incredible. There was doctors that I knew in their practice, they had no idea what was going on through a billing person, and they ended up being arrested later on because they were stealing constantly. And it was stealing in my mind, but they were overbilling. They were taking
Okay.
a service that
Okay.
should have been this dollar amount and overbilling it and never telling the doctor, collecting the money, and they were enjoying their particular activity a lot more than someone else. So it's not always, even though the physicians are the number one creator of where the fraud comes from, you are correct. The staff is as much as involved because of all the different parts of what goes
Right,
on
there's many
with our
hands.
yes, and it happens in the hospital settings. It happens in hospice, which is really scary when we think about what hospice is. Of course, it happens in nursing homes. It happens all over the place where so much of our medical care is intertwined with who's taking care of what to do what. Do I need that shot? Was I supposed to get that shot? Did I get that shot? And that brings up one of the second biggest point that we have to do. We have to be our own best detective. We have to figure out what's going on with my personal Medicare. And truthfully, we do have two systems. If you're in a Medicare Advantage plan, you get an EOB, an explanation
I was just gonna
of
say,
benefits.
Let's talk about those. So
You get
EOB
them.
is an explanation of benefits.
Yes.
What happened, what occurred.
What occurred.
And when what is being paid for by your insurance and what isn't, right?
Yeah. And on the Medicare side, you get an MSN, a Medicare Summary Notice. Those are
Okay.
the same things. Now, if you're in traditional Medicare, you get an MSN. If you're in an Advantage plan, you get an EOB. But you're right, Ann, this is exactly what we do. We went and did something, and 6 weeks later, we received something, and we try to remember, is that what really
What happened?
You know, because I remember we talked
Yes.
about, but we don't remember all the things that really happened.
Yep.
And if we don't look at those EOBs, the explanation of benefits, or MSNs, our Medicare summary notices, then we are opening up the whole system to fraud, because our understanding is, well, don't worry about it. Our insurance company paid for it.
Well, and I'm going to add one thing on that, and probably on both. I don't know about those two in particular, but mine also, when you open that up, what is stamped on there? This is not a bill.
Yes, yes.
So if I do remember that I've been somewhere 6 weeks ago, as you said, we'll use that scenario. So time has gone by, and I'm now feeling better because I was not feeling well. So you're not really right then. Now I get this, and I open it up, and I'm trying to figure it out, and all I see is this is not a bill. Okay, then.
It's not a
I
bill.
don't have to pay anything.
It is not a
goes
bill.
in the trash.
I don't have to worry about it. It's
Right.
not a bill. It is not a bill. Problem is, 2 weeks later, you do get a bill,
Right.
and you're trying to figure out, well,
What am I paying?
why didn't my insurance pay for this? Why didn't my Advantage plan? Why didn't Medicare pay for this? And instantly we have lack of recollection of exactly what happened, and we look down and we go, no, wait a minute, I got billed 3 times in the same day for the same
Right.
service. Well, that's a red flag. If you look at your EOBs and your MSNs and you see something that occurred on the same date at the same time 3 or 4 times, you know, our society, we're made up of computers. And it's very simple to have one finger on a computer just hit and it goes, and it didn't mean
Yeah.
there was no fraud involved.
Yeah.
It just
Oops.
happened, and it came out that you were billed 3 or 4 times for the same thing. Well, the problem with that is if it happens to one person and you multiply that times the number of people in Medicare, we have $68 billion, and that's where we end up. So we need to learn the 2 very clear things first. Learn to protect yourself. If you learn to protect yourself and be very knowledgeable of who's taking what from you, and how do I know that this person, I don't want to have my red, white, and blue card, a much
Yes.
better explanation than a Medicare card. I don't want my red, white, and blue paper card floating around somewhere. I want someone to be able to, well, I'll keep it. Thank you. It is yours. It belongs to you. And then if we become our own best detective, we actually look at the things that occur.
And also, I'm just going to say, when you say and compare what you had done, but sometimes you also want to make sure that you look back on the date. Like, so was your appointment really that date? Did they bill another day? So it looks like 2 days out of that time they did something and you only were there once. I mean, sometimes that you want to look
That
at
is-
just to make sure that was the date you had, that appointment or that test or whatever it was.
I think
Okay.
there, in most cases, and I'm doing this so often with people, if it feels wrong to you, if you read something and, you know what, that doesn't look right, there's a pretty good chance that it isn't right. Because you looked and you started, you know, I don't remember it being exactly that way. And of course, that becomes the third part. So we've learned to protect ourselves. We've now become our own best detective. What do we do with it? What do we do with information? I mean, it's wonderful to think this, but now what do I do? Well, we need to have the courage to report it. And I say to have the courage to report it. It would be very difficult for most of us, especially if we had the same doctors or medical practice for 20 or 30 years, to all of a sudden discover something.
Well, and on top of that, even just calling a doctor, if you have one doctor, to make an appointment, let's say, you know, you're getting a voicemail, and the voicemail tells you if you're a doctor, do this. If it's an emergency, do this. If you want to make an appointment, if you need to talk to a nurse, if you want to get a prescription. So there's all those different numbers even that you're listening for. And if it doesn't say, if you want to report fraud, dial 8, you know. So you're not really sure. So you kind of don't know.
No, and the issue is, was it just an error? Was it just a mistake that somebody made? Did somebody put a number in wrong?
An extra zero.
Something. Did somebody put, you know, they were working and it just ended up on the computer that the wrong number was put in? Everything in Medicare is done by codes. There's 70,000 different codes that the doctors have to deal with. 70. So there is room for error. Not everything that happens is fraud.
Yes.
Not everything. There isn't that, you know, oh my gosh, everybody's doing things terrible to us. No, it is $68 billion, and that is a scary number. But not everything that happens is fraud. And somewhere along the line, you're correct. It's really hard because if the billing service is done outsourced, and we find an address that's in Cleveland, Ohio, we're not going to call Cleveland, Ohio. Right. We're going to call the doctor, and the doctor's going to say,
well, that's my first instinct, is to call the doctor and say, okay, I received this bill, you assume from them, that's your assumption, because you weren't there, and even if you get through to somebody, you know, you really have to know, in a sense, what you're talking about. You want to say, I saw this on my bill, I don't understand this, or the date was wrong, or it looks like you charged a couple of times, or did it really cost this amount? I mean, what do we really want to, and is that the right place to go? Should I start with just inquiring with my physician? Maybe it's as simple as, yeah, they did hit the wrong button when they put it in. Or, you know, should I start with that direction first to talk with the office?
That is on, as an organization, our Senior Medicare Patrol, that's what we are called, the SMP. We are called the Senior Medicare Patrol. That is what, well, I always think of it as going back to grade school when you were crossing guard and you safety patrol. So we are in the Senior Medicare Patrol. Okay. And you're right, we always tell people, okay, when you're looking at something and you see where it looks a little odd, yes, the first place to call would be your doctor's office or wherever you receive the services, because at this point in time we have all the quick cares and everything else, and we need to call them and say, I'm not sure. One of the things that occurs so often is the fact that they don't see Dr. Bartlett. They see, you know, Patty over here, and Patty was, because in today's medical market we have all different. We have physician's assistants who really work in doctor's offices and see patients and everything else. There's protocol for all that, but we look at the bill and we didn't see Dr. Vogel. We saw, and we think, well, that's all wrong. Something's really wrong here, because I never even saw my doctor that day. He wasn't even in the building, but I'm getting billed for this, okay? So yes, your thought process is right. Call the doctor's office, ask, and the difficulty is they have to go back and find a record to find that if you're correct or they're correct, if you were off by a couple of days, if you were off by a couple of codes, all those things have to be put back in sequence so we can find out if it was just an error, if it was a simple error that can be corrected right over the phone, if it's something that needs documents to be sent back and forth, or is it truly fraud? And that's where it becomes the issue of the question is, what happens? What happens when I report Medicare fraud?
And then if they say, if I'm at the doctor and they're like, no, that's not, do I stop there and assume they're going to investigate? Is there a place to call you, senior Medicare Patrol people?
Yes.
Do I call since, it's federal dollar, the president,
Yes, call the president.
Yeah,
Call the
call him.
president instantly. Call him first before you call.
Yeah, before you call you.
Before you call us.
What's the next step then?
Yeah, and of course, because we're dealing with a population that is always been raised with a trust factor, a true trust factor, that we look and we'll accept the first explanation. And that's the difficult part about fraud. They'll accept it. And at that point, when you really hang up and you go, you know what, that still isn't right, that is the second question, who do you call? Because in most cases, if a doctor's practice office is going to say, well, let me refer you to, and you're going to get another number, whether it be an 800 number with a whole bunch of push 1, push 2s and everything else, and you become very frustrated about it. Somewhere along the line you're looking to get an answer and you seem to be getting more questions because people are trying to, well, I'm not sure if that, I can't, I'll get back to you and all those kinds of things, and they're hoping that you go away.
And then it's frustrating, so you might decide to stop.
You might decide to stop, but don't. But don't. You can always call us, the Senior Medicare Patrol.
How do I do that?
We have an 800 number.
Okay.
We have an 800 number, 1-800-356-3606. We have a website that you can actually go on to, www.carie.org. You can always call the Pennsylvania Prize Program, and we will follow up, which is an 800 number, 1-800-783-7067. So somebody calls, and it actually gets reported to us, to the Senior Medicare Patrol down in Philadelphia. That's who answers that 800 number. So they will answer it. It's a live person. You don't get hung up somewhere. You're actually going to speak to somebody, and we will do. The organization within itself does do the investigations. They do the initial investigations and figuring out, billing, was it an error, is it actually going on, this is the 15th person who reported the same thing. Wow, red flags. So we can now do things. We are very much involved in steps, and obviously we have prosecuted to the millions and millions of dollars of people, but the Office of Inspector General gets involved in this, the Attorney Generals in each of the states get involved in this, the FBI gets involved in this, there are Medicaid fraud units as well as Medicare fraud units that actually go out into areas where we find a consistent issue with this. And I'll just to give you a very simple example here. There was 243 people arrested. They had committed $712 million, and it was all down in Florida. So somewhere along the line, obviously, well, that made sense. There's a lot of retirees and seniors in the Florida area.
And some that live there year-round, but some that are coming and going.
We have our snowbirds.
Till we catch up, till
Yep. So, there is a whole process that occurs once we've gone through the first two steps, which are steps that we hope they do. We hope they do right, and we hope they are protecting themselves. We hope that they are being their best detective, but we also want them to know that reporting this does not make them the evil person. It's not the bad thing that you're doing. It is the right thing to do, because more times than not, you're actually saving the rest of us who belong to Medicare those situations that do spread like wildfire, where you have somebody who's doing something over and over and over, and they're jumping from state to state to state. The number of phone calls, Medicare never calls anyone. So if you ever get a phone call saying, I'm calling from Medicare, do yourself a big favor and hang up. Hang up. If you get a couple of calls like that, then please call us.
Okay.
Please call us, and
They can use that
we will
same 800
same
number?
800
Okay.
number, and we will do the investigation into it. We have done that on many occasions where we've actually caught people who are calling not even from this country and trying to get a claim number. All I need. We always have to remember, really simple, in most cases of starting of fraud, the line will be, all I need to do is verify your numbers. I don't need your numbers, I just need to verify them. And they'll give you a number that doesn't, it kind of sounds right, and because we're just so used to, we go, oh no, that's not right, my number is. So be careful
It
about...
happens so quickly, unexpectedly, and very fast.
So Medicare fraud, sadly, Ann, does happen. It's not part of the job of being involved in the Medicare system that I overly enjoy, because I think people really are honest and truthful people, but I have learned over all these years that it's actually $68.8 billion doesn't just happen, it truly happens.
And as you said, folks, we're paying into the system. I want that system to be there when I need it and I'm ready for it, and I don't want to have to deal with extra pieces of areas of the coverage where I have to pay more because we've had a history of all of this. So I like these words, and I think it might sum it up a little bit, is you hear the buzzwords protect, detect, and report, right?
That's it.
So that kind of says it in terms of, you said protect and prevent. Do a couple things for yourself as far as keep close to the Medicare card. We'll use the right term, keep close to the Medicare card. Check those EOBs and MSNs to really make sure that you can at least match, this was the day, this seems to be the procedure, the physician, the location, it's making sense. That's kind of that piece. And then I'm going to report, really, if I'm concerned or I start to begin to question. I like that word too, question, whether with the beginning with wherever I went, whether it was a physician's office, another, as you said, quick care kind of urgent care thing. And then really, if that's not right, report it and have folks that are trained to follow through and really detect and investigate, as you said, so that we want it to be preserved, and it's not being bad or wrong. It's really due diligence to do that. In like 2 minutes that we have left, how would you like to summarize, wrap this up? Give us a couple of other tips or examples, anything that you want to say in the last 2 minutes about Medicare fraud.
Medicare fraud only happens because of the simple fact that we don't believe that it actually is going on. That's how it happens. You were correct in the beginning really quickly. The difference between a credit card fraud and getting your credit card reissued and stopped and everything else, you only get one Social Security number in your life. It has become our Medicare claim number. Until that system changes where we don't use that and there's nothing happening there, your Social Security number is your claim number. I ask you to be as diligent, and good word, diligent, about protecting that, because once it's gone, there's no real way to get it back without having something occur to you, and it can be financially devastating of what goes on. There has been way too many in just the last 5 years of services, especially to women, that have been cut or changed or cost you more because those dollars are no longer there to have those services free to you, and we look and we go, it's a part of Medicare that should never exist, but it does. Okay.
Well, thank you. I think it's certainly really an important area, I hate to say that, but an important area in our series all about Medicare, this Medicare fraud, what it is, due diligence, detect and report. And again, thank you, John Vogel, for being here and really being that person who is part of the Senior Medicare Patrol, helping us to do that and detect and protect ourselves. So thank you so much for tuning in to our segment today on Medicare fraud.